This is Nightside on WBZ News Radio 1030.
We are going to now talk about those of us who are aging. Everyone within the sound of my voice is aging. And Dr. Jürgen Bludau, who is an internist. He works at Brigham and Women's Hospital, Harvard-trained geriatrician. This is your first book?
This is my first book, yes, Dan.
Okay, now what prompted you to obviously your area of expertise, but why do you feel a book like this? Easy read, by the way. I've read good portions of it at dinner tonight.
Mm-hmm. Thank you. Why did I do it? Well, it was actually my patients. I've given many talks at places, assisted living facilities, daycare programs, elder service programs, and people come up to me and say, listen, it's very nice what you do and your message is very important, but there are only 50 people here. Why don't you write a book and get your message out to more people? And that's inspired me.
What's the message? What's the overall message before we get into some of the specifics?
Yeah, I think the message is that we can't stop aging. We are going to age. There's nothing nobody can do.
Even Ponce de Leon.
Yes, and he didn't find it. And, it's interesting, Dan. He was looking in Florida for the Fountain of Youth, and Florida is sometimes considered the nursing home of
Heaven's Waiting Room, I think it's referred to as well.
Okay, that's, well, you said that. But there's nothing we can do about aging. However, there are many things we can do to grow old better. And avoid some of the pitfalls of growing old. Some of them maybe help make the diseases which an older person is more susceptible to, make them less of a problem for an older person.
Well, you made the point in one of the early chapters. As I said, I was reading your book at dinner tonight, had dinner alone, explaining to a friend of mine earlier tonight who said, well, you must have a lot of time before your shows. No, I don't. I try to actually figure out what's going on. And you were talking about how susceptible we are in our early years as we are young children, and then how susceptible we become in our later years.
Yes, there is still some mirror image between pediatrics and geriatrics. We pretty much deal with the same problems in babies and older people. Now, that's not to say, and we want to be very careful about this, that we should treat older people like children or that older people are like children. By all means, that's not the case. But an older person sometimes, or we always encourage older people, our older patients, to come along with a caregiver. We talk to the caregiver. We have two patients. We have the patient and the caregiver in our office. No pediatrician would ever interview a 1-year-old without the mother, father, or somebody else around. So the same thing. We have a caregiver on both sides.
You a 6 or 7-year-old either.
Yeah, well, absolutely. And we use different medications. Well, or we use medication in different dosages in the elderly. Same in children. There are diseases which are specific for the elderly. For example, dementia, primarily one of the major problems. There are diseases specific for children. That's why they are pediatrician. That's why they are geriatricians.
As people grow old, and of course our definition of growing old, today the President's Commission on the debt problem is talking about raising the retirement ages. Mm-hmm. I think by the year 2075, people will not be able to retire or at least get Social Security until they're 69. People can actually get Social Security retirement now at the age of 62 if they want. Mm-hmm. And of course that is because life expectancies are being extended dramatically in the 20th century. Extension.
Yeah, we've been very successful. Medicine, I should say, has been extremely successful in making people live longer. The life expectancy, not the lifespan, whether 120 or whatever it is. That hasn't changed, but the life expectancy. And we did this through good public...
What's the difference between lifespan and life expectancy?
Well, life expectancy is what currently a baby born in the United States, a female baby, has an 80-year life expectancy if everything goes well. And that's good, but in some Asian states, it's even higher. So, I mean, this is not something amazing in the United States.
So a lifespan would be sort of like the outside possibilities.
Right, that's exactly.
And no one's living after 120.
No. I mean, that's
or let's say the odds are significantly stacked against you.
Very much so.
Okay, and that is because you're almost born to die. I mean,
exactly. There is sort of the moment of breakdown of it. It starts very early, and you can see that in babies and children. You can see already some damage to arteries. It's quite amazing how the sort of, let's say, a decline, if you want to say this.
What can people do who are listening tonight? I want them to have an opportunity to read your book, because it's amazing the number of subjects you carry here, not only in terms of health-related issues, but the whole question of sexuality for older people, the quality of life. But at what point should people be thinking about these issues?
The book is written really for the older adults, and by definition, geriatric patients are 65 and older. Now, whether that is still okay in 2010, it was fine in 1970, but that's another topic for another evening. So for the older adult, who really wants to know what he or she should be doing and what is possible and what's not possible. And then it's also written for the adult children who want to know how they can help, how they can best take care of their older patients, where to get the information, because there is not much information outside. I mean, there are many books written about older people, but very specific evidence-based, scientifically and evidence-based information written in layman's term. This is what this book gives people.
So give us an